this is just your first days in Miami as a medical student, so I'm a resident. I'm going to be taking you around, showing you how we treat patients here at the Miami hospitals.
Right.
We're just basically going to give you an idea of how things flow here, how to do basic exams, and what kind of classification we typically get in this hospital.
Okay.
So you feel pretty prepared, ready to do some exams?
So. I'm ready for anything.
Okay, anything, yes.
Anything.
You can have most anything in this kind of exam. I mean, and just any kind of patient. Miami Hospital. We're really going to need you to come here.
Sir, we just cleaned the floor.
That's all right, Velez. Help me! Now, we really need you to sit down. We just need you to bring it in. This is Miami Hospital, Ross University student. We really need you to take control. Just have a seat. We really need you to have a seat.
Go ahead. Take a seat.
Well, okay. All right, if you're comfortable on the floor, that's fine. We like to adapt ourselves so we can do the interview with any style. We want to make sure the patient's comfort is provided for. We really want to make sure. Now, see, I've already actually done a few tests already. He's grasped me my clothing. He seems to be relatively firm strength in the right hand. So we've already done one test. See how you can work in these tests? It's pretty cool, huh? It's actually neat how you can work in the test in real life. So what we're going to do is we should start out we really should start with a history, but a physical exam will be all right if the patient is not compliant as this one appears to be. So we're going to start out with just a few tests here. So we just washed our hands. So everything's going to be great. We're not going to press anything. So the basic ones we want to do is we first probably want to do a neurological exam. It's always good to do that. All right. I'm going to need you to straighten your arm out as such. All right. And just grit your teeth, and I'm going to try to reflex it. All right. We're going to check it over here now. I'm not thrilled with that response.
No, there wasn't much.
No, I rate that. I'm going to be conservative, call that a +1. We're going to call that one a +2 over there. Just be okay with that. Just be okay with that. Now, I think what we want to do now is we want to check cranial nerves. So we're going to start with the Raines and the Weber's test just to take cranial nerve 8. So here's how we're going to do it. We're going to just strike the tuning fork, put it on the forehead, and which ear do you hear it louder in?
Aren't you helping me?
Which ear?
Oh, we're trying, sir. We're trying.
Oh, can you believe? I tried to do the Weber's test with the 256. Can you believe I overlooked something that simple? Oh my gosh, I'm so embarrassed. Oh, okay. All right, well, we'll skip that for now. We'll skip that for now. All right, so what we're going to do, I guess we should move on to blood pressure. And normally I like to do this in the left arm, just for practice. So you know the basic steps, measuring the cuff, right? So, yeah, that looks to be about, well, not ideal for him, and I'm sure the the bladder is definitely not ideal. So I'd like to go ahead and take his blood pressure. So I'll just wrap it around like that. You know what? I don't think I'm going to be thrilled with the response here. We probably will just go with a peripheral pulse exam. So we'll just grab a pulse. Does he appear? Now what? You're third. You're third year.
He seems to be in respiratory distress.
Respiratory distress. What are you suspecting?
I don't know, maybe he's gotten an infection or something.
Could be consolidation. You could go ahead and run a few tests on him if you'd like. You could do the basics of percussion and palpation. He really needs to have a good response. You know, this would be a good time to do the cardio because when they're not breathing, the cardiac sounds come out a lot louder.
Yeah. So
we can go ahead and just do it. And you can start with the palpation of the precordium, just right here and here. But you know what? I think this might be better for this patient is if we do a neurological exam of the sensories. So, if you could just tell me, we're just going to use fingertips for this one. Light touch. This is light touch. Tell me, do you feel that? Tell me yes or no. Tell me yes or no. Yes or no. Where's the bag with the arm in it? We really need to check that. All right, so we'll get the ambulance corps to determine where that bag is. I'm not thrilled with his response on the right though. It seems like
he's not saying anything.
Yeah, non-responsive. We could try the glabellar tap reflex just to rule out Parkinson's. You know, this could be classic signs of Parkinson's. So we'll just. All right, see, his eyes are closed. We can't really run a glabellar on his eye. I really need you to open up your eyes so we can do this test. Can you open up your eyes?
Can you open up the first couple numbers here? That's about 6 feet.
Yeah, that's about 6 feet. Yeah, okay. All right, can you just read the lowest line you can? Well, we'll cover one eye for you. All right, just read the lowest line you can. Okay, I'm not thrilled with his scores on these things. He's neurological, so he probably has like a Wallenberg's or maybe some sort of lateral medullary syndrome. Okay, now
he's got a neuropsychiatric. He's getting better.
Motor's intact. He's clearly getting better. Let's just prescribe him some prednisone and we'll just send him out.
Are you in any pain, sir?
Yeah, we might want to give him some prednisone just in case. We like to give oxygen to patients. It really doesn't do anything, but we like to think it does. All right. Oh, and of course, the mainstay. This is Ross University. We have to prescribe a little bit of paracetamol, so we'll put on 5 capsules of paracetamol just to be safe. Is there anything else? Any other workups you'd like to do on this guy? Any labs you think we should run? Basic lab, maybe like a CBC, Chem 7, something to check like that. We need to make sure he's not got an infection.
Yeah.
That's good. That's good.
We can do that, yeah.
Yeah. You know what? We could test his reflexes in his lower. Oh, watch the blood. It's a little slippery.
Yeah.
All right. I do like that you dress casual. This is Miami Hospital. We like casual wear. We like casual wear. Now, ideally, the knee would be flexed, so we just have to.
I think he's got wrist drop.
Really? Where is
Yeah.
that? Oh, look, yeah, he does clear. The wrist is dropped. The wrist is dropped. We could check for that with a radial nerve sensation. We could do a little pinprick test, see if that comes back abnormal. Not thrilled though, because look at this. Look at this. No response. Not even slice. It's not even like I'm hitting the right spot though. I know what you're thinking. I'm hitting the right spot though. No, but no response bilaterally. That can indicate maybe he's got a lower motor neuron lesion. I would really like to take his blood pressure, but it appears that he might have some sort of fistula going on the right. So we really would ideally use the left. When that arm gets in from the ambulance corps, we'll run the test on that. Yeah. Yeah. Well, you know what? We're just going to leave you with our nurses, and we'll get back to you as soon as we can. Until then, let's just start the prednisone.
Sure.
And
Yeah.
we'll push some paracetamol.
Yeah.
So someone will be in to hand you your insurance forms. All right. Thank you. Oh, always thank your patient.
Oh, thanks, sir.